I really feel that I don't need to specialize in just one thing for my entire life to be the best surgeon possible. So in my previous video, I talked a bit about how a varied experience and practice can help a plastic surgeon give a patient a best result. And nowadays, I just do cosmetic surgery of the entire body, the face, the breast, but I really feel I draw on my past experience as a reconstructive surgeon, and also from various procedures that I do, they cross over so that I can give patients my best results. So for example, when I was starting out, I did a lot of head and neck reconstruction, and that's surgery where there's cancer or some sort of problem in the face and the neck, and another surgeon basically takes out that cancer, and then I'm responsible to rebuild it. That usually involves taking parts of the face or the neck or the jaw or the facial bones apart and then filling it with something else. And that really gives somebody a large insight and more experience and more knowledge about the anatomy of the face and the neck and the head so that people can understand surgery better and honestly do surgery better. So I really draw on that background of my early days as a reconstructive surgeon to help my patients more as a cosmetic surgeon because I feel so comfortable doing procedures in that area. The other thing that really helped me as a cosmetic surgeon is my prior experience in craniofacial surgery, and that's generally the surgery on the bones of the face, usually because of some either congenital defect or some sort of trauma to the bones of the skull. And in my experience, that was basically when people are in car accidents or they get hit in the face, they break their bones and the bones have to be put together. That again involves taking the face apart, exposing the bones, putting them back together, usually plates and screws. And that was an invaluable experience to understand the bones of the face, how they give structure to the face so that I can do procedures such as facelifts, chin augmentations, bony work of the jaw, taking out bone, contouring the cheekbone. In facial feminization surgery, I'm often reshaping this area as well as the jaw. All those experiences in the past, working on the bones of the face, have really helped me. The other experience that really helped me as a plastic surgeon in my body contouring surgery, which I do a lot of in the Middle East, is my early initial experience with bariatric patients. Bariatric surgery is surgery that general surgeons do, and what they do is they rearrange or reroute the digestive system so you don't absorb food as much. And this is for patients who are obese, and this becomes a serious medical problem. So they get this surgery so that they can lose a lot of weight, and sometimes the amount of weight that they lose is massive. They started doing that type of surgery about 20 years ago, and that's really when I first got to Hawaii. And at the time, I was one of the few plastic surgeons that was doing this sort of body contouring surgery after patients had lost all this weight. What happens when you lose that much weight is that although you lose weight, the skin does not shrink down and go away after somebody has been larger. So people have a lot of loose skin. And that was a new problem in plastic surgeries, something that was very interesting to deal with, and I had very early experience on. I think that experience really helps me in the Middle East because bariatric surgery kind of caught on later, and by then I had so much experience with these patients. So when I got to the Middle East, I became very well known for doing body contouring surgery because I had so much experience with it, which really helped me in the Middle East because bariatric surgery became extremely popular, even more so than it has been in the United States. The other reconstructive surgery I did a lot of was breast reconstruction, and that's primarily for cancer, for women who lose their breasts or lose part of their breast after breast cancer. Honestly, there is nothing more difficult than taking a woman's chest from virtually no skin and nothing and rebuilding it into a natural appearing breast that matches their other side. And this is surgery that was very rewarding for me, but it's given me a very unique view on how to perform cosmetic breast surgery because the techniques that we use in breast reconstruction are actually applicable and help me very much when I do breast augmentation revision surgery, breast lifts, and any sort of complex breast surgery. I think if a surgeon only has experience with breast augmentation and that's all they do, that's great and that's fine, and many surgeons are very talented with that. But when it comes to more complex cases where there's asymmetry or there's something different about the breast, or this is revision work, a work that's been done in the past, I think my breast reconstruction experience really is invaluable to me and really works well for my patients to give them the best results. So there you have it. That's more of why I think a varied background as a plastic surgeon. Plastic surgeons work from head to toe, various different problems, and I really see my practice evolve into doing different things so that I can do them even better. And I really draw on that prior experience to give my patients the best results. And I really feel that I don't need to specialize in just one thing for my entire life to be the best surgeon possible. I think all this varied experience really helps me become the best surgeon that I can be so that I can give my patients the best results. And that's very rewarding, and that's what I love to do. So thanks a lot for watching this video. Please give us a like or comment down below. If you like this content, please subscribe to this channel, and we'll see you next time.